This presentation is on ransomware by Shannon Dorchek, Nurse 360, Sarah Barker. With technology constantly increasing, cyber attacks are becoming more common. According to Argos, there are nearly 1 million new malware threats released every day. Companies, including the healthcare industry, are having a hard time deciphering how to fend off hackers because they are getting more creative. This presentation will discuss a form of malware called ransomware. We will discuss what it is, how it spreads, why it's a danger to patients, the legal and ethical concerns, and how we can prevent it. What is ransomware? Ransomware is a form of malware that inhibits users from retrieving their system or personal files and demands ransom payment to regain access. The earliest variants of ransomware were developed in the late 1980s, and payment was to be sent via snail mail. Today, ransomware authors direct that the payment be sent via cryptocurrency or credit card. Ransomware is one of the most profitable income channels for cyber criminals, so malware authors continually improve their malware code to better target their enterprise environments. How does ransomware spread? Ransomware attacks have arisen as a major threat to individuals and businesses alike. When the malware is run, it locks the victim's files and allows criminals to mandate payment to release them. Microsoft Office, Adobe PDF, and image files have targeted, but McAfee predicts that additional types of files will become targets as ransomware continues to evolve. To decrypt files, cybercriminals typically request payment in the form of cryptocurrency like Bitcoin. The standard rate is about $500, though it has been documented that the price could be much higher. The cybercriminals behind the ransomware attacks typically place emphasis on wealthy countries and cities where people and businesses can manage to pay for the ransom. Why is ransomware a danger to patients? The healthcare industry is particularly vulnerable to cyber attacks. A computer-like virus could put people in mortal danger. If the target is healthcare facilities, since hospital systems constantly rely on technology for up-to-date information with lab results, radiology results, and documentation, they are in the perfect position for attackers to extort them. If health professionals can't immediately have access to drug histories, surgery directives, and other information, patient care will become delayed or halted, which makes hospital officials more likely to pay a ransom immediately rather than risk delays that could result in death and lawsuits. The hardware for MRI machines, ventilators, and some types of microscopes are running by computers. Those computers come with software that the makers are responsible for supporting. Sometimes the people who make the machines stop supporting them after an extended period, which means the old software can become vulnerable to attacks. Between 2009 and 2019, there have been over 2,500 ransomware attacks in the hospital. Ethical issues of ransomware. As a healthcare professional, we have the obligation to keep patients' information private. As a healthcare industry, we must provide the security and promise that we will have up-to-date computer security to ensure we will not experience cyber attacks. Many European companies face the ethical dilemma whether to pay or not when ransomware attacks. An incident that occurred at Hollywood Presbyterian Medical Center faced the ethical dilemma when they decided to pay $17,000 than to risk a shutdown of their life-saving equipment. Argos stated that the administrators decided to pay the money because they understood that patient safety is more important than standing against their views to not pay the money. Legal issues of ransomware. If a hospital system becomes a target to a ransomware attack, they may sustain civic and criminal penalties related to the Health Insurance Portability and Accountability Act of 1996. As a patient, if your protected health information has been revealed because of a healthcare data breach, or if you believe your information has been stolen from a specific healthcare organization, you may be able to take legal action against the breached entity to recuperate damage for any suffered losses because of the breach. To initiate a lawsuit, you must contact an attorney to take legal action against a HIPAA-covered entity. An attorney that is well-versed in HIPAA regulations will allow you to have the greatest chance to win the case. You're also able to join an existing class action lawsuit. The more individuals complicated, the sturdier the case is likely to be. Many class action suits have been filed on behalf of data breach victims that have yet to experience harm to the exposure of theft of their data. The plaintiffs claim for damages for future harm because of their data being stolen. However, without evidence of actual harm, the chances of success will be greatly reduced. Preventing ransomware attacks. Education is crucial on the prevention of ransomware attacks. As a health industry that deals with a multitude of private information, you must be vigilant on what you click on. Ask yourself, do I know who is sending me this email? Is the email from the correct email address? Am I checking my personal email on my work computer? Companies must also ensure that their IT, security, and other staff or partners are proficient in prevention, detection, and incident response. The healthcare systems must keep up to date on an effective security system. With the expansion of technology in the healthcare industry, we must remember that ransomware is a serious concern. We must stay vigilant and stay up to date on education to reduce the chances of infecting our system. Staying educated and prepared will greatly reduce the risk of becoming a victim and exploiting our patients.